focus as COVID numbers cross 40,000 mark in the national capital. Home Minister Amit Shah will chair an all-party meeting today to chalk out the strategy to combat the COVID crisis in the capital. Yesterday, Home Minister Amit Shah and the Health Minister Dr. Harshvardhan met Delhi Lieutenant Governor Anil Baijal and Chief Minister Arvind Kejriwal and announced a slew of measures to be taken to deal with the capital's medical crisis. Delhi's hospital bed capacity will be increased by 8,000. Contact mapping and house-to-house survey of every family has been planned, and it has been made compulsory for residents in containment zones to have the Arogya Setu app. In addition to this, testing will be doubled in the next couple of days and tripled in the next 6 days. Well, going across to my colleague Rupeshri for more details. Rupeshri, constant consolidated efforts visible between the centre and the state since yesterday, with a series of meetings that were held yesterday. And in today's meeting, we're expecting other parties to join in as well.
Well, Vandana, yesterday's meeting actually has the potential of being a real breakthrough meeting when it comes to handling the COVID-19 crisis here in the capital. Remember, earlier the Delhi government was almost left on its own and was completely cash-strapped, had few resources, and battling and also complaining that it had received no help from the central government. But all that is set to change with Home Minister Amit Shah's intervention yesterday, and the kind of resources that he has placed at the disposal of the Delhi government, and including the human resources teams that have also been deployed by the Health Minister Harshvardhan. I remember Delhi for the third consecutive day has reported more than 2,000 cases. It reported the highest single spike again yesterday with 2,224. So the number of cases are really galloping in the capital at a very rapid rate, and the cumulative has gone up to 41,184. The other additional worry is that it reported again 56 deaths. So the casualty has also is slowly rising. It has gone up to 1,300. It has crossed 1,300 mark. So that also is a real worry for the capital. Apart from that, the heartening thing that came out of the meeting yesterday was that the municipal corporations, the central government and the state government came on board and tried to work out a joint strategy in order to deal with the crisis in the capital. And now remember, the most important part of it is, of course, that over today and tomorrow, Delhi will be testing at least 10,000 people, and apart from that, the kind of capacity that has been promised to the Delhi government in terms of beds, railway coaches, and also medical infrastructure like ventilators, oxygen concentrators also are set to increase. Apart from that, the third most important point to remember is that the case of pricing. So that has been that is being dealt with both by the central government and by the state government. So we do expect some relief on that front also. Today in the all-party meeting, actually, we expect some parties in Delhi to raise the concern about the manner in which Delhi has allowed for a complete reopening, and perhaps make the demand that certain parts of Delhi like malls and restaurants and religious places be shut down in the face of the rising cases in the capital. But it remains to be seen exactly what happens, but definitely an attempt to bring all parties on board when the capital is facing such a serious crisis.
Right, stay on with us, Rupeshri. Let's also go across to Arunima, who joins us. Arunima, have the other parties who've been invited today confirmed attendance?
Yes, all of them, the Delhi units have to attend. So the parties which are active in Delhi, only they are going to be part of this meeting. In the past, when such a meeting was called by the Home Minister, we saw the Aam Aadmi Party representatives, we saw representatives from the Bharatiya Janata Party, from the Congress, and smaller parties of like BSP, which have some presence. They participated, but mainly it is the Congress, the BJP, and the Aam Aadmi Party. They are the major players in the capital. And in this corona pandemic, we have seen Congress take a very vocal stand. Ajay Makan, for example, has been very critical of both the Bharatiya Janata Party led municipal corporations as well as the Aam Aadmi Party led state government. But the purpose of this meeting is to try and ensure that criticism doesn't go to a level where it becomes destructive. Criticism is utilized to better coordinate and try and join hands in this fight against the corona pandemic. That was the message that was given to the municipality mayors also yesterday. The difference again there, most of the municipalities under the Bharatiya Janata Party, whereas the state government under the Aam Aadmi Party. The message there also was that please work in coordination, and I think that's the message that the Home Minister wants to give today as well. But there are a lot of concern areas. There are a lot of concerns about the way state government is implementing some of the measures. Those will be flagged off. Rupashi already mentioned the need to containment zone, some steps taken, but should we shut down some key areas? Repeated rumors about lockdown starting from 15 June, starting from 18 June have been denied by PIB fact checker. Ministry of Home Affairs has come on record to deny that lockdown was discussed yesterday. So that's something that they have told us. But given the rising numbers, could there be some other form of containment that is decided today at the All Party? We'll have to wait and watch that.
All right. In fact, stay on with us, Arunima. After holding meetings with the Health Ministry, Delhi Lieutenant Governor and mayors of all MCDs and other top officials yesterday, the Home Ministry has issued an order that dead bodies of suspected COVID victims in Delhi will be handed over to their families immediately without waiting for lab confirmation. Now, as per the Home Minister's directions, the Health Ministry has set up 3 teams of 4 doctors each from AIIMS Delhi, Directorate General of Health Services, Union Health Ministry and the Delhi government to inspect major dedicated COVID-19 facilities proposed in Delhi and to make recommendations for improvement. But going back across to Arunima, it looks like the centre has taken cognizance of the miserable condition in which many hospitals were keeping the dead bodies and now have said that they need to immediately be handed over to the families.
Yes, I think Sneha Modani was pointing out that this seems to be in contravention of the ICMR guidelines, because ICMR guidelines said that you must test before handing over the body. But given the fact that testing is taking so much time and there is a huge crisis in the mortuary management, many news channels have reported, newspapers have reported, and we reported the horror as well from LNJP, how bodies are being swapped and people are being denied a chance to say a final goodbye to their loved ones. We reported on LNJP, Chandra and Mukesh family. One cremated his father twice. The other couldn't even see the face of his mother because the body was swapped. Such horror stories have been brought to the notice of the government, and therefore they have decided that don't wait for the lab test results. Just hand over the to the family the dead body of the patient. Also reduce the time that is being spent before funeral is undertaken, because there's so much of rush at Punjabi Ghat or at Nigambod Ghat. Therefore, it was taking time, and that was leading to the distress of the families. So those have been taken into account. But on the ground, how much changes after these instructions are given, how good is the implementation of the decisions taken, that perhaps will decide if things really change for Delhi.
All right, Arunima, thank you for joining us.